Hi, so in this video we are going to learn the pathophysiology of bradykinesia. Now, bradykinesia, the slow movement or difficulty initiating the movement, like raising from the chair or tying your shoelaces. So here are the two neurons which will represent in our video. This one will represent the green one, direct pathway, and the red one, indirect pathway, since the green one is stimulatory or the red one is inhibitory, and the blue one is dopaminergic pathway. Okay, so normally the dopamine, when it's released on the direct pathway, it stimulates and helps you initiate the movement. So and the dopaminergic neuron on the indirect pathway will inhibit the indirect pathway. So the direct pathway stimulating the agonist muscle, and the indirect pathway inhibiting the antagonist muscles and balancing the action. So in when the substantia nigra cells die in Parkinson disease, there is a degeneration of these neurons. When there is a degeneration of these neurons, it will lead to the drop in the dopamine. When there is no or less dopamine, it will be very difficult for the person with Parkinson disease to initiate the movement. But once they initiate the movement, it will be very hard for them to stop. So this is what the pathophysiology of bradykinesia is. Now I'm going to show you a video to see what it is like in patients with bradykinesia. Okay, so here is the video. Now the person here uh, having difficulty raising from the chair means initiating the movement. That is one form of bradykinesia. Okay. The tremors and the pathophysiology of tremors and Parkinson disease. Here we have the blue neurons, which are the dopaminergic system. The yellow one is cholinergic system, and the green will represent our direct pathway, and the red one will represent our indirect pathway. Now, the dopamine will stimulate the direct pathway. The dopamine will stimulate the direct pathway and lead to contraction of agonist muscle to perform or initiate the movement. That is what the dopamine does when it stimulates the direct pathway, and it will inhibit the indirect pathway, which uh, inhibits the antagonist muscles, right? But the cholinergic system works opposite of the dopaminergic system. It inhibits the direct pathway and it stimulates the indirect pathway. Now, in Parkinson disease, when you have the substantia nigra degeneration, where the neurons of dopaminergic system degenerate, when these neurons degenerate, it leads to decrease in the dopa. Now, decrease dopa, and on the other hand, increase acetylcholine. There must be a balance between dopa and acetylcholine for our muscles to contract in normal fashion. But when there is decreased dopa in Parkinson disease and increased acetylcholine, it will lead to our neuronal circuits to fire fast. Now, the reverberating circuits will fire fast, okay? And that will lead to the agonist muscle contraction and the antagonist muscle contraction in alternate fashion, making your limbs or body to shake. There is a video that I have here. Let me show you. There is a pill rolling tremors, which is one of the sign in Parkinson patients. It's like someone is rolling a pill in index and thumb fingers, called pill rolling. It's one of the one sort of tremors in Parkinson patients. Now that's the reason that we give the benztropine, which is anticholinergic drug, and this anticholinergic drug will inhibit the cholinergic system, so it helps you to relieve the tremors in Parkinson patients. Rigidity, the pathophysiology of rigidity. Normally, when the cortical neurons, when they fire, they inhibit here, they release the GABA. The GABA inhibits the reticular system. This is the reticular system. And when it's being inhibited, the neurons in the spinal cord does not fire abnormally, and they stimulate agonist and inhibit the antagonist, and the person function normal, right? But when these neurons in the cortex, when they degenerate, there is drop in the GABA release. Okay, when there's drop in the GABA release, this reticular system is released of inhibition, and when it's released of inhibition, it becomes excited and fires abnormally to the spinal cord neurons, and the spinal cord neurons leads to stimulation of agonist and antagonist. They both, when they are stimulated, they will contract and lead to increase in body tone, which is why you have a very stiff posture in Parkinson disease, which is called rigidity. Here is a video that shows a person is having a cogwheel rigidity in elbow joint. This means when you apply the force or resistance, it feels the same throughout, and that's why we call it cogwheel rigidity.